Hi, how are you today? This is Dr. Kilcup. My website is darylkilcupdc.com, and today I want to talk to you about how to treat depression without using medication. If that's something that interests you, stick around. I have an article about this as well. The article goes into much more detail than I will on this video. It also has links to other articles that I've written that will give you even more details. So if you love the content, if you love the details, check out the article. The first category that I would like to bring up that deals with depression is out of balance neurotransmitters. Now I know that comes as no surprise because everyone's heard about serotonin and how that low levels of serotonin are responsible for depression, anxiety, and it's usually a very common treatment. The problem is that there are 6 different neurotransmitters, and you can have imbalances with more than one. And if all you're doing is treating something related to serotonin that isn't based on any kind of testing, how do you know if that's really what you need? I guess by your symptoms, if you feel better. The problem is that often when people take medication is they have terrible side effects with it. And the reason is that these neurotransmitters work beyond the brain and beyond being responsible for how you feel. 90% of the serotonin is actually in your intestines, and where they help with your digestion and intestinal motility. And so when you start messing around with levels of neurotransmitters, you can do more harm than good a lot of times. So there are 2 neurotransmitters that are inhibitory, and there are 4 that are excitatory. And through testing, we can find out which ones are low, which ones are high, and we can help balance those things out by using the nutrients that those that are required. For example, say someone is low in dopamine, which is a excitatory neurotransmitter. Dopamine, in order to make dopamine, your body needs vitamin C, vitamin D, iron, vitamin B3. And if any one of those things are low, like vitamin D so often is, I find it almost universally low on people that we check, it's going to contribute to a low dopamine level, and this can cause symptoms like depression. So out of balance neurotransmitters are a big category that can cause depression. There are ways to treat it that don't require medication, and for more details I encourage you to look at the article. The second problem that often leads to depression, again, is no big surprise. I call it stinking thinking. You know how our thoughts are powerful things, and what we allow ourselves to think influences how we feel. And I find that often people are believing lies that just aren't true, and it's leading them to get sick. And so often, counseling to help people through that is really important. So that is one category. Another category, that's the second. The third category that can cause depression is intestinal problems. As I mentioned earlier, 90% of the serotonin in the body is made in the intestine. And furthermore, the inflammation that is often in the intestine when things aren't right, when you have out of balance bacteria, when you have harmful bacteria, these things lead to inflammation, which can cause the brain to become inflamed, which can lead to all kinds of neurologic conditions, including depression. I would say that the intestinal problems are so common, it could be the most common cause of depression that we find today. And most of my patients with depression are also having intestinal problems. And as we're able to diagnose those situations, and I go into great detail on the article about this, we see people's depression go away. So it is a category that can not just cause depression, but many things, intestinal problems. If you think of it, your intestines are really critical. If your intestines aren't right, even if you eat really healthy foods and take really healthy supplements, if your intestines aren't working right, you aren't going to absorb them. Nothing really is going to go right until the intestinal tract is healthy and robust and working right. So it's a big deal, and something that we need to look at really carefully when we have a patient that's struggling with depression and has for years, and we want to fix it without medication. The fourth topic that is often a problem with people with depression are thyroid problems. Thyroid problems, especially hypothyroid, can make you just feel terrible. And often the standard medical workup for thyroid is just poor. It's very, it might involve a thyroid stimulating hormone, and that's it. It might involve one of the thyroid hormones like T4, and that's it. The problem is that there can be many thyroid conditions that has a relatively normal thyroid stimulating hormone that the thyroid can still be dysfunctional, and the patient can be suffering from hypothyroid as a result. So a thorough workup with the thyroid in patients that are struggling with depression is something that we do. And we look to see if the thyroid is healthy and working right, because if it's not, depression is one thing that can happen with a dysfunctional thyroid. The fifth thing is adrenal problems. I've written about this. There's other articles on my website. The links are on the article. But the adrenal glands are tied into neurotransmitters. Norepinephrine and or adrenaline and noradrenaline, both are made in the adrenal glands. The balance of these hormones affect the adrenal glands, and the adrenal glands affect the balance of these hormones. I find often people that have been under stress for extended periods of times have adrenal glands that are not functioning correctly. Their cortisol levels are very low, and it leads to more inflammation, which can cause problems in the brain and other places in the body, but it can definitely lead to depression and be part of depression, and something that we always rule out when we're doing a workup with a patient that's been struggling with depression. And finally, the last thing that I want to talk about is diet. You know, we are coming out of, thankfully, an era where we were told that we should eat low-fat, high-carbohydrate diets. That was the way to be healthy. The problem is, and it's, you know, driven me nuts, because it's just not true. You can't have a healthy body and eat a low-fat diet. You need healthy fats to make hormones, to make neurotransmitters, to have healthy cell membranes, to have a healthy brain. Your brain has a lot of fat in it. And all of these things require that we have essential fatty acids in our diets. And people that eat diets, obviously, I think I don't have to convince you that if you eat a lot of junk food, processed sugar foods, that you're going to have lots of health problems. But even people who are trying to eat healthy and are eating a lot of carbohydrates, low-fat foods, it's going to lead to depression. It's pretty much a recipe for depression. So diet is something that needs to be worked out with patients. I'll often take a diet history and educate the patients on how to eat right and get the right kinds of nutrients into their system. So those are the 6 categories, and many times I find that patients have a combination of these things. There isn't just one thing wrong. It's kind of a puzzle, and they have 1 or 2 or 3 or more of different degrees of these things wrong. And a functional medicine doctor is going to do the thorough history. He's going to get to the root of these things and really get a person healthy. And that's what's at the heart of what I'm doing. And I hope this video has helped. This is a huge topic, and each one of these things are areas that we could talk about for a long time. But I wanted to get this out there, and I would love to talk with you, answer your questions. So you can reach me through my website in the comment section. You can email me through my website, and I would love to help. So thank you for watching.